In this video, we'll look at how health insurance is arranged in the Netherlands. You can use the chapters in the video description to quickly access the specific information you're looking for. Everyone who lives or works in the Netherlands is legally obliged to take out basic health insurance. This covers costs such as visits to your general practitioner, medication from the pharmacy, and hospital care. It's important that you register with a Dutch health insurance company within 4 months of arrival. The government determines exactly what is included in the basic healthcare plan, which is designed to cover the bulk of your essential medical care. In addition, insurers can offer supplementary insurance packages that cover, for example, physiotherapy or dental care. Insured care is equal for everyone. However, the way you receive it can vary greatly. You can choose either an in-kind or restitution policy, or a combination of both. With an in-kind policy, your health insurer reimburses the care costs only if the care provider has a contract with your health insurer. With a restitution policy, you'll be free to choose from any hospital or healthcare provider. In-kind policies are generally cheaper than restitution policies. What's more, ONVZ has contracts with many different healthcare providers, which means you can get the care you need quickly. We can even help you with waiting lists. Because we've contracted so many healthcare providers, we can more easily find one that's available. Everyone with the same policy pays the same amount. Age or health status don't play a role. Every insurance has a mandatory policy excess. The excess is an annual amount for medical costs that adults have to pay out of pocket before any costs are reimbursed under the basic healthcare insurance. If you don't expect healthcare costs and would like a discount on your premium, you can voluntarily increase the mandatory excess. But bear in mind that you will also have to pay more out of pocket if you do incur healthcare costs. For some care covered by the basic insurance, you don't have to pay an excess. For example, general practitioner care or maternity care. With your basic insurance sorted, the first thing you need to do is register with a general practitioner or GP, known in Holland as the huisarts, even if you don't need medical care right away. The role of the GP is central to the Dutch healthcare system. For many newcomers, this is the most important difference with back home. Your GP is the first person you visit when you have health complaints, including mental health issues. This is called primary care, and you can arrange a visit without a referral. The GP can refer you to a medical specialist if necessary. This is called secondary care, and you can only access it by means of a referral from your GP. All visits to the GP are covered. You don't pay an excess. However, if the GP refers you to a medical specialist or orders blood tests, or if you are prescribed medication, you will have to pay the excess for those services. If you go on vacation or need to travel abroad for work, you can also receive care from healthcare providers abroad. The basic insurance reimburses the cost of emergency care abroad up to the amount that this care would cost in the Netherlands. If the costs abroad are higher, you will have to pay the difference yourself. With ONVZ, you can also insure yourself for the part you otherwise would have had to pay with additional insurance called Wereldfit. If you want to know more about the Dutch healthcare system, simply download our guide or contact our service center.